Go ahead. Thank you. What's your call sign? Fantastic. What's the age and sex of the patient? 32-year-old male. Do we have a name? Okay. Fantastic. What's the time of the incident, please? And what was the mechanism of injury? Slid onto left hip and pelvis. And can I confirm that was 14.14 miles per hour?
No, 40.
40 miles per hour, 40 miles per hour, thank you. Okay, so slid onto left hip and pelvis. Okay, from your examinations, what suspected injuries have you got?
So top toe are significant injuries are highly probable pelvic fracture and left proximal femur.
Left proximal femur and pelvis proximal femur. Okay, vital signs please. Heart rate 120. Respirate 24.
Blood pressure 120/70.
120 over 70.
Temperature 37.
Temperature 37. 96% sat on air. BM is 9.2. And GCS? 50. Fantastic. And any treatments that you've given so far?
He's got a green cannula in the right antecubital fossa.
So an 18 gauge green in right antecubital fossa. 5 milligrams of IV morphine. And at what time was that?
That was 10 minutes ago.
Okay, so at 09:50 hours. Okay, and what's your ETA?
ETA is 10 minutes.
10 minutes, 10. And you're coming by land or helicopter?
By land.
Okay, we'll have people waiting for you when you get here. Thank you very much. Bye. Okay, so
to decide what level of response this trauma requires, turn the page.
I need to do a trauma patient pre-alert. Let's work my way down this flowchart. Okay, so we've got a heart rate greater than 90. We've got a suspected major pelvic fracture. Doing a quick whip through. I don't think I've got yes to any more, but yes to any of the above, and I activate the major trauma team alert. Okay, so I'm going to dial 2222. Trauma alert, ED resus, ETA 10 minutes. That's a trauma alert, ED resus, ETA 10 minutes. Thank you.
Right, morning team.
Morning.
We are expecting a major trauma patient. I'm Chris, ED consultant and trauma team leader. We are expecting a 32-year-old male who's come off his motorcycle at 40 miles an hour with a probable pelvic fracture and a probable left femur fracture. He is tachycardic at 120, blood pressure is 120/70, SAT 96, GCS 15. He's got green cannula and he's had 5 of morphine. ETA is 10 minutes. Right, relocation. Penny, you're already scribing. Rachel, are you competent to manage an airway and log roll if need be?
Yeah.
Splendid, you're my top end doctor. Ruby, you're my ED nurse, please. Your job is to put monitoring and drugs and assist with log rolling and interventions.
Got it.
Max, are you competent to do breathing and circulation? Sure. Splendid. Rachel, can you check and get your equipment ready and a laryngoscope if you need it? Max, can you get your cannulation kit and a pelvic binder and a Kendrick splint or Prometheus? All we have. Okay, any questions, team? Right, would you all come to Penny, give your name, rank, serial number, and collect a sticker for your gown?
The major trauma paperwork lives at the nurse in charge's station next to the red phone. Each team member is responsible for making sure they are signed in and must document whether they were present when the patient arrived or at what point they did arrive.
I'd like you to take over and coordinate log roll off the back mat onto our trauma mattress, please.
Right, so can we deflate and unclip?
The max is deflated. Bottom is unclipped.
Okay, and we've got a pat slide, have we?
Yep.
Okay. Alright, is anybody not ready?
I am ready.
We're going to roll on 3. 1, 2, 3. And down on 3. 1, 2, 3. Anybody not ready? We're going to go. Anybody not ready? We're going to go across on 3. 1, 2, 3.
Yeah. Ready for me to move this out the way?
Yeah, go ahead.
Right team, can we start our primary survey? Penny, can you put some monitoring on? Rachel, how's the airway?
So Ben, can you hear me? The airway's taken.
Thank you.
Hi Ben, I'm Max. I'm another one of the doctors.
The clinicians carrying out the A to E assessment must be trained in the ATLS or ETC principles of trauma assessment.
So we've got a central trachea. Anteriorly there's no subcutaneous emphysema. Is anything sore here over your clavicles, Ben? Doesn't look like it. Anything down the front of your chest, Ben? Can you take a big breath in for me? Does it hurt at all when you're breathing like that? And keep going with those big breaths.
Are you warm enough, eh?
Yes, all right.
Yeah? Good. Good. Just a few days of your chest, sweetheart. Now just check your blood pressure in a minute. Righty?
So we've got no anterior chest wall tenderness.
Right,
We've
okay.
got equal bilateral there. I'm just going to have a quick feel further down your tummy, Ben.
Matt, just brief carry on. What's the stats?
No? Not even in here?
So we're waiting for monitoring to come through.
Looks like 96%. That'll do me.
So that's a 96%. He doesn't appear to be in respiratory distress.
Thank you.
Give me a shout again, Ben, if there's anywhere that's sore that I find, okay? So the abdomen is soft. As I move slightly further onto the pelvis.
The pelvis should be inspected and carefully palpated by a trained clinician so as not to disrupt potential unstable fractures.
Quite a lot. Ben, do you mind if I lift up your gown? Okay. So there's a big bruise overlying the lateral aspect of the left leg.
Okay.
The proximal femur looks deformed. Is that sore there, Ben? I'll stop doing it then.
Okay, so we've got a tender pelvis, probable left femur fracture, and a tachycardia of 120. I'd like to carry on with your survey. Prep for a wide bore cannula, bloods, cross match, pelvic binder, and a Kendrick split, please.
So just moving distally down the limb. There's intact pulses there. And cat refill is less than 2 seconds.
Okay team, we're going to put a pelvic binder on.
Okay.
Penny, would you internally rotate the ankles and put the legs together, please?
Sorry, Ben. Might be a bit
At the same
sore
time,
for a
would you
minute.
check peripheral pulses?
Can
while
you
you're there?
check the pulses whilst I'm
So intact on left side, intact on right side. Also both intact.
Okay, thank you. So the ankles are secured, can you rotate it?
Yeah.
Patient's
Happy?
trousers underwear have been removed, so we're going binder to skin. Can you make sure the binder is positioned at the greater trochanter, please?
Okay. Yeah.
Right. So
So should we cut it?
cut the T-pod, leaving a gap of 6 to 8 centimetres, please.
Okay,
No.
relax it, let it go soft.
Is that enough?
That looks perfect. Attach the Velcro tabs. And Matt, can you pull? Oh, yeah.
Okay, it's going to feel like a little cuddle of your hips there, Ben.
And that's
It
right.
should actually make that feel more comfortable. Okay.
Grand. And Max, would you check the peripheral pulses again, please? Right, Rachel, could you complete our disability assessment? And Penny, could you complete our E-assessment by doing a temperature?
Ben, I'm just going to shine a light in your eyes, okay? Pupils are equal and reactive.
Okay.
Ben, do you know where you are at the moment? Okay, and can you just move your arm for me? Lift your arm up. Well done, good. Okay, so GCS 15.
Thank you. Penny, once you've done the temperature, could we have a blood sugar as well, please?
Absolutely. Okay, temperature is 36.2.
And apart from our femoral fracture, I can't see any other evidence of external haemorrhage or any other injuries in the current position. Right team, we've got our pelvic binder on, however the patient appears to be deteriorating. In the context of trauma, I'm concerned with a major haemorrhage. Matt, could you use e-resus to get the major haemorrhage guidelines up for us, please?
Blood, Steve? Yeah, blood, had an ECG.
Right, so this patient has evidence of uncontrolled bleeding, so that fits major haemorrhage. Matt, I'm going to assign you to look after the major haemorrhage protocol. Can you put a 2222 call out for an adult major haemorrhage shock pack A, and can you liaise with blood bank and portering to get the kits? Penny,
Yes.
for major haemorrhage, I think we need 2 nurses to help get blood out of the fridge and administer to the patient.
Okay.
This is a man. I would like O positive crash blood from our fridge to start with, please.
Okay, O positive. I can do that one by myself using the blood tracks, so I'll get the O positive and show it to you before I start.
Thank you.
Hello, could I activate adult major haemorrhage protocol to ED resus?